am Dr.Sandeep Vaishya. I am the Executive Director of Neurosurgery at Fortis Research Institute in Gurugram. I am the incoming President of the World Spinal Column Society, and I am the member of the Spine Committee of the World Federation of Neurosurgery. I am also the section editor for Spine for World Neurosurgery, which is one of the major neurosurgery journals. So I am going to discuss about some myths about the spine surgery which are prevalent in the society. One of the biggest myths is that if the patient goes to a spine surgeon, the spine surgeon will always recommend surgery. Again, not all patients need surgery. Actually, patients with back pain, less than 5% of those will require surgery of any sort for any reason. Now, patients who come to me, they are already referred patients who have already been diagnosed with the problem. So in my practice, almost 50% patients would need surgery, but by and large, very few % people in the society will need a spine surgery. So in which conditions a person would need surgery? So there are different problems in the spine that may require surgery. That may include a disc prolapse, it may include a fracture or an accident. There can be tumors in the spine, there can be cancer in the spine, there can be TB or other type of infections. There can be congenital malformations like spinal dystrophism. So whether most of the tumors would need surgery, spinal dystrophism would need surgery, many of the fractures would. So the dilemma comes in patients of disc prolapse or a canal stenosis patients, which is a degenerative disease. So not all disc patients need surgery. Only those patients whose pain is persistent and not getting better with conservative measures and is hampering the quality of life, they will need surgery. Or if it is causing any neurological deficits or weakness or numbness, then they may need surgery. So not all patients will require surgery, but those patients who need surgery will actually need it, because without surgery they can become worse and their quality of life will be bad. So one myth is that all spine surgeries are major surgeries. Actually, these days with improved technology, many of these surgeries have become minimally invasive, and many of them have become sort of daycare surgeries, like patient comes in, gets operated and goes home next day. And in many of these surgeries, particularly disc surgeries or canal stenosis or tumor surgeries, are incision sizes less than 2 centimeters. And patients are up and about within few hours of surgery. So another myth is that recovery from spine surgery is very painful. So like any surgery, spine surgery will also cause some pain. But as I mentioned before, with minimally invasive surgeries, the pain is minimized and most of the patients are mobile within few hours after surgery. If you do a really big surgery, like for example a scoliosis surgery or multi-level fixation surgery, yes, it can be painful and patients can take few weeks to recover, but usually most patients are back to their job within 2 to 3 weeks. People worry that they will be addicted to painkillers after spine surgery. Many of the patients who come for surgery, they already have been taking painkillers for a long time and some of them are actually addicted to them. While most patients after surgery are off painkillers within days or weeks after surgery. Most of the patients won't need any medicines few weeks after surgery. And the biggest myth that the patients and the whole society has, that a lot of patients will get paralyzed after spine surgery and they will never be able to walk. When the patient comes, and it is usually not a doctor who has told them, it is their relatives and friends who have told them the fact that they will not be able to walk after spine surgery. Again, this is without any basis and without any knowledge. In very few situations, in very difficult tumors, the outcome may be bad, and that is usually less than 1% cases. Most of the patients are expected to do very well. They should be able to walk within few hours of surgery, and actually most patients do. So you can interview many patients who have undergone such spine surgeries and you can find out how well they are doing. So I tell all my patients who have been told by their relatives that not to get surgery done, that to go back to them after surgery and tell them that how well they did, and not to spread such kind of lies in society.